Hi, I'm back from my surgery. In this episode, I'm going to talk about explaining how I had lasered my tumor to the surgeon, how many rounds of Mohs surgery I had, the very interesting way that a plastic surgeon stitches you up, the pain or not that I felt during the surgery, as well as a bit of an overall description of our commute to Vancouver and back for the day. So, first question is, how did I explain to the surgeon that I had lasered my own tumor, or John did it for me? So, if you recall, I had talked to my dermatologist in Nanaimo, and he had advised that I go ahead with the surgery because there might be roots remaining, and I did. And at the time in July, I didn't have any symptoms of any tumor remnants, but a couple months ago I did, so I went for the surgery, and it happened on April the 5th, about 9 days ago. So I go in, and there's a assistant, and she greets me a couple of hours before the surgery, and I explained to her that I lasered the tumor and that I need to tell the surgeon that. So she said she's going to give her a heads up, but that I should also tell the surgeon. So I felt good about that. That was one big worry for me. When I see the surgeon, I also tell the surgeon once again, and her reaction, which had been preempted with the assistants already telling her, was, "Good for you, I'm glad you did something about it." In the meantime, she recognized the very, very long wait from the time of the referral, which was February 2023, to the surgery date April 5th, 2024. And then we talked about where I was seeing evidence of basal cell carcinoma above where the tumor site was and below. And she said she's going to start below, and we'll go from there. Because it's Mohs, if you recall, it's done in stages. So that's the part of the explaining, which went really well. And that was one worry that was over. So how many rounds of Mohs did I have? It went very fast, but at the same time very slow. Altogether, I was in there for 5 hours. There was a 2-hour wait after my appointment time. And then when she came in and I had that conversation about where things were, the first surgery, including the local anesthetic, was about 4 minutes. That's how fast they are. There's a bit of a smell that you smell when they're cutting, but you don't feel much at all. And then they leave to do the biopsy to figure out if there's more cancer above, to the right, to the left, or below. You wait half an hour, come back, and she said, "Yep, you're right, there's still some up above, we're going to get it." And we'll be posting photos as I'm speaking of the surgery as it happened, because I took pictures. Of course, they put a bandage on you every time they take a piece and then disappear. As soon as they disappeared, you're allowed to walk around, so I would take it off, take a snapshot, and then just relax. So, second round comes in, she takes that other piece, and then comes back after half an hour. She said, "You're all clear, we've checked that one, and there's no cancer further in any direction." And then it takes 15 minutes to suture me up. And she did a freaking amazing job, because I don't know if you can see, but we'll take another closer shot. But this is 9 days after the surgery. Really amazing. It's 1 inch long, and yeah, pretty darned amazing. Very talented lady. So about the pain, did it hurt? It didn't hurt other than the first injection of the local anesthetic, and then all you feel is pressure, and it's numb, basically. So nothing to worry about. 5 hours I was numb, and in between the surgeries I was walking around and thinking to myself, hey, it's okay, I'm okay. Because a few weeks before I was kind of terrified, and I was having nightmares, losing sleep, as well as about a year ago when I looked at all the pictures. And then in between time I kind of put a pause on worrying, which was good. But one of the things that happened that day is I kind of felt like I went through a rite of passage, and I passed into this space where I felt really at peace in that room. And not because she had stitched me up yet. but I just felt everything was going to be fine. And maybe that's what people call acceptance. And I was in that place, and I felt good. And I was sending photos, gory pictures to John, so he could see what was going on while he was waiting. That was the emotional pain, which was also gone, which was wonderful. How did she stitch me up? This was really cool. Now, the surgeon was very personable, by the way. Every time she did something, she would explain it to me before. They had this mirror, they showed you what they were doing. When she drew the first circle where they were going to cut, she was telling me where she was going to cut. And then when she was coming to suture me, she was also explaining what she was doing. They do cover your eye at one point, and it's not great to look at something coming at you, so I appreciated that. But she said they're going to do what they call darts. So imagine the two pieces of skin, which was kind of tear-shaped, and they put little darts, so imagine little darts here, except they're not aligned to each other. They're like this. So when she stitched me up, it's like dovetailing, just like with wood, and that's what they did. And I thought that was pretty cool. I guess that's a plastic surgeon's technique, and the result is pretty darned amazing. So super happy, and a huge load off my mind, because I was comfortable with having a big scar across my face. That's what I thought was going to happen, and it looks like it's not going to even be visible in a month. How did our commute go? So we got up at 6 in the morning, and in order to catch the 8:30 ferry, because we have to be there an hour early and all that went well, because if you don't catch that ferry, the 8:30 ferry, you're going to be late for a 12:30 appointment. So we were there at 11, went for a walk, came back, and what happened in the course of the day was I was being asked by the surgeon if I had a reservation to go back. Now this was a Friday, and Friday the ferries are pretty full coming back, and no, I didn't do a reservation because the time frame they gave me for the surgery was 3 to 8 hours, and possibly longer if there's a complication. So of course I can't make a reservation. So in the period when she was suturing me, she gave instructions to her staff to write me a assured loading pass, which puts you at the front of the ferry and gets you on immediately regardless of how full the ferry is. And that was super, super handy, because by the time we got out, it was after 4. We made it to the 6:30 ferry, and I was home by 8 and in bed with Tylenol. So thank you for watching, and I'm going to make one video about aftercare, because they spend 15 minutes or 20 minutes afterwards giving you directions for the first 3 weeks and for the 3 weeks after that, which I'll talk about. And when I was on the ferry, I had this lovely bandage across my face, but there were no children screaming or running away from me. Again, thanks for watching, and bye.